Okay, when I say hi, everybody say hi, Dr. Julie. Hi, everybody. That was really excellent for this early in the morning. I'm not going to make you do it twice. I think that's infantilizing. Thank you. A long, long time ago, I can still remember the first time I was at Horizons, and I was speaking, and it was good. And yea, verily, I did attend all the others. And now here we are. This is the building where I graduated my Mount Sinai psychiatric residency, where the chairman told me that MDMA PTSD research would never happen at Mount Sinai, and that was not correct. And also, first time that I took MDMA with my partner Jeremy was right across the street in a lovely garden. And then flash forward 4 years later, we got married in the exact same spot across the street 25 years ago this week. That was lovely, Jeremy. I had our second final child right down the block at Mount Sinai. So I'm happy to be here, is what I'm trying to say. This place means a lot to me. This neighborhood means a lot to me. I know it's not downtown, but it's like the second best place to be in, I think. Central Park is, everybody should get over to the garden across the street before you leave here at some point. Not now. So usually Horizons is in the fall, and you guys get like the autumn harvest pumpkin spice version of Dr. Julie. What you don't know, and who you may not know, is the sort of springtime, fresh, nearly hypomanic Dr. Julie. So that's who you're getting today. Enjoy. I saw a bumper sticker recently that I really love that it spoke to me. It said, "I tried to constrain myself, but I escaped." It's like, I feel seen. I get that. So Horizons is 16. We all know 16-year-olds. What do we know about them? They like risk-taking, they think they're invincible, and they think they know everything. You know that whole freshman, sophomore thing, fresh person, sophomore, where it's like you don't know anything and you don't know anything, and then later you don't know anything, but you don't know anything. This is where we're working today. This is the many shades of gray. And the most important thing I can ask everybody here is to try to approach with that sort of Buddhist don't know mind and take in, have a widened perspective. I mean, you know, we're all very interested in transpersonal, self-transcendent experiences, and the whole point there is that you experience a more fluid, interconnected perspective, and that your perspective is expanded, you know, beyond your predictable, constricted worldview. So that's what we're doing today. So, you know, it's easier to learn in a parasympathetic state, right? We've all understand, not fight or flight. The other one, rest, digest, repair. That's where we learn, that's where we grow, that's where our social skills are good. Our social skills aren't very good when we're in fight or flight, right? We learn when we're in awe and when we're open. And when we're in a deeply parasympathetic state, that is an opportunity for oxytocin to work its magic. Oxytocin is very involved in not just bonding and trust, but also in learning and memory. And you learn better in an open state. And we learn better in community. There are really interesting animal studies proving that if you take an animal and in isolation, you try to teach it something, you put it back to isolation, it doesn't learn very well. If you take it from its friends and you teach it a maze, and then you send it back to its friends, it remembers the maze, okay? We are all here to learn new things, see our old friends, make new friends. All of that requires us to be in parasympathetic. If you don't understand, read my book, Good Chemistry, to learn more. So just two more things. So don't have sex with your patients or your clients. Just always wanna put that out there. Just a little quick thing to remember. Am I supposed to do this? No. But what if? No. You know, I'm not saying it's an easy thing to do, all right? I've had plenty of attractive patients, and maybe they were attracted to me or I was attracted to them, but it's the thing I'm supposed to do. It's not just like the right choice, it's the only choice. So that's all I'm gonna say about that for this moment. If you will give me your enthusiastic consent, we will proceed with the proceedings. There's no more ado. The next person who's speaking at the opening remarks, so yes, we're 5-10 minutes late. It's not so bad. Vivian Yi is a health program analyst, and they are with the Stephen Alexandra Cohen Foundation. And I'm going to turn the floor over to Vivian.
So good morning, everyone. Like Julie said, my name is Vivian. I'm a program officer at the Stephen and Alexandra Cohen Foundation. Thank you again to the Horizons team for organizing this very important conference and for having us here. Before we get into the rest of today's program, I'd just like to say a few words on behalf of the foundation. Heard we're running late, so I'll keep it short and sweet. We all know that for millions of people and their loved ones, things like depression, PTSD, addiction, anxiety, these are all very real issues and part of their daily lives. Some people are lucky enough to find relief through our current treatment approaches, but many, many more do not. So for those who have not been helped by our existing treatments, psychedelics really are an encouraging new opportunity to help alleviate suffering and really improve the quality of people's lives. The Stephen and Alexandra Cohen Foundation is committed to helping people in need and solving complex problems, which is why we are proud to be one of the largest private funders in psychedelic research in the country. Thank you to everyone, the researchers, patients, caregivers, advocates, entrepreneurs, funders, forebearers, I don't think I'm leaving anyone out, and more who have helped set the stage for psychedelic medicines today and in the future. Thank you.